We often shy away from discussing sexually transmitted infections or STIs, but these infections are more common than we think. It's crucial to understand them. We need to know their causes, symptoms, and treatments. Knowledge is power. It helps us protect ourselves and our partners. Ignoring STIs won't make them disappear. Let's break the silence. Let's arm ourselves with information. This knowledge is vital for our health and well-being. Syphilis, a bacterial infection, has plagued humanity for centuries. Caused by the bacterium, it spreads through direct contact with a syphilis sore. These sores typically appear on the genitals, but can also surface on the mouth or anus. Syphilis transmission primarily occurs during vaginal, anal, or oral sex. The bacterium enters the body through tiny breaks in the skin or mucous membranes. Sharing needles also poses a risk, though less common. Pregnant individuals with syphilis can even transmit the infection to their unborn child. Syphilis is a master of disguise, progressing through 4 distinct stages, each with its unique set of symptoms. The first stage, primary syphilis, typically announces itself with a painless sore called a chancre. This sore usually appears at the infection site and can easily go unnoticed. The second stage, secondary syphilis, often mimics other illnesses. A rash on the palms and soles, coupled with flu-like symptoms like fever, fatigue, and sore throat, can easily mislead. Hair loss, swollen lymph nodes, and sores in the mouth, vagina, or anus might also occur. The third stage, latent syphilis, is a silent stalker with no noticeable symptoms. However, the infection remains active within the body. Finally, tertiary syphilis emerges, often years after the initial infection, with devastating consequences for the heart, brain, blood vessels, and other organs. Thankfully, syphilis, when detected early, is highly treatable with antibiotics. Penicillin remains the gold standard treatment. The dosage and duration depend on the stage of the infection. Early stages often require a single injection, while later stages might necessitate multiple injections or intravenous administration. Prevention is always better than cure. Practicing safe sex by using condoms and dental dams during oral sex significantly reduces the risk of transmission. Regular STI testing is paramount, especially for those with multiple sexual partners. Openly communicating with partners about one's STI status fosters trust and allows informed decisions about sexual health. Section 5. Gonorrhea, the silent infection. Gonorrhea, often dubbed the clap or the drip, is another prevalent STI caused by the bacterium. Like syphilis, it spreads through sexual contact, including vaginal, anal, and oral sex. The bacteria can infect the genitals, rectum, and throat. Furthermore, gonorrhea can be passed from an infected mother to her baby during childbirth. What makes gonorrhea particularly dangerous is its silent nature. Many infected individuals remain asymptomatic, unknowingly spreading the infection. This silent spread contributes to its high prevalence. Section 6. Gonorrhea symptoms, a gendered perspective. When symptoms do surface, they often differ between men and women. Men might experience a burning sensation during urination, accompanied by a white, yellow, or green discharge from the penis. Pain or swelling in the testicles might also occur. Women, unfortunately, often have mild or no symptoms. Unusual vaginal discharge, pain during urination, or bleeding between periods might be the only clues. Rectal infection can manifest as discharge, pain, or itching in the rectum. Throat infection, as with other gonorrhea infections, often remains asymptomatic but can cause a sore throat. Section 7. Tackling gonorrhea, treatments and safeguards. Despite increasing antibiotic resistance, gonorrhea remains treatable with antibiotics. Typically, a single dose of ceftriaxone, coupled with a one-time dose of azithromycin, effectively tackles the infection. Following a healthcare provider's recommendations and completing the full course of treatment is crucial. Prevention strategies mirror those for syphilis. Using condoms and dental dams during sexual activities significantly reduces transmission risk. Regular STI screenings, especially for individuals with multiple sexual partners, are crucial. Avoiding sexual contact with partners who exhibit symptoms of gonorrhea or other STIs is also essential. Section 8. Herpes, a lifelong companion. Herpes, unlike syphilis and gonorrhea, is caused by a virus, not a bacterium. The herpes simplex virus, or HSV, has two main types: HSV1, typically responsible for oral herpes, and HSV2, usually associated with genital herpes. Herpes spreads through direct skin-to-skin contact, often during sexual activity. Unfortunately, there's no cure for herpes. Once infected, the virus establishes a lifelong presence in the body. However, don't despair. Effective management strategies can minimize outbreaks and reduce transmission risk. Section 9. Herpes management, treatment and prevention strategies. While herpes cannot be cured, antiviral medications effectively manage the infection. These medications reduce outbreak frequency and severity and lower the risk of transmission. They can be taken episodically during outbreaks or daily for suppression. Prevention strategies for herpes are multifaceted. Using condoms or dental dams during sexual activity reduces but doesn't eliminate transmission risk. Avoiding skin-to-skin contact during outbreaks is crucial. Openly communicating with sexual partners about one's herpes status allows for informed decisions and reduces stigma. Finally, taking antiviral medications as prescribed by a healthcare provider further minimizes transmission risk. Remember, knowledge is power. Understanding STIs like syphilis, gonorrhea, and herpes empowers us to protect ourselves and our partners. Regular STI testing, open communication about sexual health, and consistent safe sex practices are the cornerstones of a healthy and fulfilling sex life.